Hi. So I wanted to go over how to help alleviate tailbone pain, lower back pain, and even pelvic floor tightness or discomfort with just using a towel. Okay. A lot of people have tailbone pain or coccyx pain either from an injury or after having a baby. Perhaps you sit down a lot at work because you're at a desk. Some people have low back pain on top of the tailbone pain as well, and other people have some tightness in their pelvic floor muscles. Believe it or not, a lot of those symptoms are tied together, whether it's because of an injury, like I said, to your back or your tailbone, or because of something going on at your pelvic floor. A lot of the attachments from our pelvic floor, which are our levator ani muscles, so those muscles that help support our pelvic organs, also have direct and indirect attachments to our tailbone and our sacrum. We also have attachments from our hip muscles and our gluteal muscles or our butt muscles into that sacral area as well, and into the lower back. So using this technique that I'm about to show you should help alleviate some of that discomfort and help you move a little bit better. So the first thing you want to do is just take a towel. I would suggest getting something that is a little bit on the thinner side. If you have those really thick, wonderful towels, they may be too big and too bulky, okay? So get your thinnest one that you've got. This one here is just a standard hotel towel. And what you want to do is take the corner here and just try to straighten it out or flatten it out as much as possible, okay? Then you're going to take it and make a knot, and you're going to try to really make a tight knot there, okay? Because this is the knot that we're going to use to help move or mobilize your tailbone. So our tailbone may get a little tight. Maybe some of the attachments to that tailbone may get tight or irritated, and you want to help with facilitation of that movement, get some oxygen into those tissues, and using something firm but soft is a great way to treat that area without giving you too much discomfort on top of that, okay? So once you get that knot, what you want to do is put it right here, right where you feel that your tailbone is at, more or less, okay? You may need to adjust a little bit, and then you're going to sit down. I would suggest sitting down on a surface that is a little bit more firm, maybe like a dining room chair or the toilet. Just kind of close the seat cover so that you have something firm. If you sit down on the bed, it may sink down and just not be as effective. So you're going to sit down, all right? You place it right where you feel like your tailbone is. And I always put the little end part here just so that I can move it a little bit easier. And you may need to adjust. I'm adjusting right now. Oh, that feels pretty good. All right, so I feel it right on my tailbone there. And then to help move or mobilize that area, you can do some pelvic tilts. So we call these anterior, meaning that your pelvis is kind of moving forward, okay, or tilting forward, and posterior, where it feels like you're almost sitting down on your back, okay? One of my students in the past used to call it happy puppy and sad puppy. So sad puppy is like where you're tucking your tail in, and happy puppy is where you're sticking it out. So doing those tilts just kind of gently, okay, relaxing your shoulders. I wasn't relaxing my shoulders there, and just moving forward and back will help just calm that whole area there and helps decrease some discomfort. You can also go from side to side. So when you do from side to side, you don't want to tilt your entire body, okay? You want to focus on bringing your hips from side to side. So you may even feel like you need to bring like that butt cheek down on one side and then rotate and seesaw it over to the other side, okay? And you can also do some, if you've got the coordination for it, some circles around it, and that may feel really good. If you feel that you need just a little bit more, perhaps just a little bit more tension or more mobility, you can take your squatty potty, and I would recommend a squatty potty to everybody. You can put this right in front of the toilet, put your feet up on it like a little stool so that you have a better positioning when you are having a bowel movement. But if you don't have that, you can take the trash can and flip it over or whatever, okay? And so you put your feet on top of it, and now you're gonna feel a little bit more pressure through that knot right on the tailbone. And here you can breathe again, you can do your tilts, or you can add a little mobility at the hips, so you can move the hip from side to side like a windshield wiper, one side, then the other side. You can also move from top to bottom. So I like to do thoracic rotations here. So I look all the way over and I can feel that tension kind of shifting over toward my right, actually. Some people only feel it on their left. I feel it a little bit more on my right. And then move over to the other side. And you can do the same thing. If you're so inclined and you want to feel just a little bit more, you can move the knee into that windshield wiper activity that we just did. And that'll give you a little bit more mobility in that area. Okay. If you feel like you may want it a bit more on the left side or the right side, then switch. Go ahead and move that knot over a little bit. And you may feel it there. You may feel like, oh, okay, now it's right over. Almost feels like a little bony prominence, like it's something hard. And it is. It's your ischial or your sits bones. A lot of people call them their sits bones because we sit on them. And we have a lot of attachments to that area as well. And if you are one of those people that gets that sciatic type pain going down the legs, but maybe it doesn't cross that knee joint line, it just goes down to the knee and the back of the leg, then this mobility with the knot may be indicated for you. So what I suggest is move the knot over to like right in the middle of your butt cheek. Okay, so if this is your bum, you know, half of your bum right here, put it like right in the middle of it. So it would be literally like right here on the meaty part of it. And you're gonna, again, sit on it. And here you can go side to side again. Now you're gonna really feel that knot over that sits bone, okay? Or that IT. And then again, you can do the mobility that you were doing before, where you can kind of windshield wiper on either side. Sometimes if you're not quite ready, like you like this pressure, but moving it like this is too much, move the other side and just kind of indirectly get a little bit more mobilization that way. Okay. You can also bring your leg down, straighten out your leg. Okay, like I'm leaning back a little bit so you can see, but you straighten out your leg and you can bend the knee again and straighten. So now you're doing maybe a little bit more of a floss for your sciatic nerve as well. And you can do it on the other side as well. So if you give these a try at home, I would say do maybe a couple of minutes of this activity, okay? I wouldn't spend 20 minutes on this because there is such a thing as too much of a good thing. So do it maybe every other day or a couple times per week so that you can get used to the pressure, get used to the movement. Sometimes when we even get a massage, we get a little sore afterwards. So being a little bit sore because of the pressure is normal, but you'll find that doing this helps relieve some of that tension. I have had patients that have said, oh my gosh, this is what I needed for that tailbone pain. It has really, really helped. So give it a try. Send me a comment or an email. I'm going to put my contact information down below as well so that you can let me know just how this treated you and how it went. And hopefully it's helpful for you. And hopefully it's a treatment that will help improve your mobility and your pain. Thank you so much.